These days, we are all sitting for hours together, and an average person sits 6 to 8 hours in a chair in an office setting. So, how to decrease the risk of heart attack or paralysis when this is the case? We'll now discuss about a muscle called soleus muscle. It is one of the 600 muscles in the human body. It is in the calf region. It is behind the calf muscle, rather below the calf muscle, and it corresponds to 1% of the body weight. That is, in a 60 kg person, it weighs around 6 kilograms. And we will see now how it can improve the metabolic health if it is activated correctly. So, basically, normal muscle function we will discuss. The normal muscle, the glucose is converted into glycogen, and this glycogen is the store, like the money in our bank. As and when it is required, the glycogen will be converted into glucose and it can be converted into energy by the muscle. However, in case of the soleus muscle, the muscle does not have any glycogen stores. Rather, it directly utilizes glucose from the blood. Just imagine that uh, a person had a heavy meal. After having a very high carbohydrate meal, the glucose in the blood increases, and now, if he can do some soleus exercise or push ups, the glucose will be taken by the muscle, and and the glucose level will be controlled. If that patient is a diabetic patient, the glucose rise after the meal will be less. And in addition, the muscle can also utilize bad cholesterol when it is working, like we'll discuss the push up. When this push up is being carried out, it was observed that the muscle utilizes a lot of glucose and fat as we have discussed, and as a result the glucose levels comes down by 50% and the insulin level also comes down by the 50%. That means the requirement of insulin will come down. Let's say if we have a diabetic patient who is on insulin, and after taking a carbohydrate meal, if they can do these push-ups, that is the leg soleus push-up, the amount of glucose rise in the blood will be low, and the amount of insulin required will also be low. And this exercise has to be done nearly 30 times. So now we'll see how is the exercise done. If we see here, we can do this exercise while standing or while sitting. With the front part of the foot on the floor, the heel will be raised slowly to its maximum point. And when it reaches the maximum point, the back part or the heel of the foot is slowly lowered down. This is one cycle, and it is recommended to do the exercise while sitting or while standing. And if some persons are very much experienced or they are gradually, they can add some part of weight on their thigh muscle as shown in this picture. So after meals, if this exercise or rather simple exercise which can be done in a chair setting when we are seated in a chair for 30 minutes, the rise in glucose levels will be controlled by this muscle. As a result, and the glucose level will be maintained. So it may improve the glucose control in diabetic patients and non-diabetic patients. Not only that, it will also control the cholesterol levels in diabetic and non-diabetic patients. So we should remember and do this exercise. And this was discovered recently by Hamilton Group. And please try this exercise as much as you can so that your sugars and cholesterol levels will be controlled very well. This exercise was more beneficial when compared with walking. So please do this exercise and have a healthy and good metabolic control of our sugars.